yes, as like the other countries in the world, Malaysia also has been affected by this global pandemic, the COVID-19 disease. Currently, in Malaysia, actually, once it started in the end of the 2019, when we heard about the COVID-19 disease outbreak in the Wuhan, right? Actually, Malaysia's government had prepared, have a strategy already to alert all to come with the guidelines and ensuring that our borders is actually being guarded accordingly, according to the international health regulations and also the guidelines that is provided by the WHO. And now, with the ongoing pandemic, of course, we had gone into the mitigation phase. Initially, we have gone to the containment phase, right, to stop and to the spread of the disease. But currently also into the mitigation phase, of course, we are preparing our capabilities of the labs, of the hospital admissions, of the management of the patients of COVID in the field, in the health facilities and the hospital admissions. At the same time, the containment of suppressing the disease is very important. So even though now in the mitigation phase, the strict control borders is still being implemented, the screening or the alerting the enforcement part to ensure that all these travelers going into the nation is being screened for the COVID-19 disease, right? And then there's a process of registering them, and then they are put into the quarantine stations. Now the travelers also, even from the start till now, they have been put into the identified quarantine stations, which has been the hotels, the hotels of all, especially in the Selangor state, where the entry point, our national KLIA airport and the Port Klang, the seaport, which is the two main ports in the Selangor here. So that's why we have more than nearly 10, right, of the quarantine stations is actually placed in the Selangor state itself. So to contain the disease, making sure that these travelers going into the Malaysia, or those Malaysians coming back to Malaysia with they are being screened and then being monitored and ensure after the 10 or 14 days they're declared clear or released from the quarantine, or the WHO, the health surveillance order that has been put to ensure that the disease is stopped of being spreading if any one of them is actually detected to have the disease. Besides that, the screening part of it, it's been there. Either it's in health surveillance in our clinics, in our for the ILI surveillance, of course, and those who have to do in the hospitals for the severe acute respiratory infection admissions, all things being done to screen, to detect, and ensure once detected, they will be isolated and treated accordingly to ensure that these those who are being detected is not in the community initially. But now in the Selangor state, I'm saying, but in the Selangor state, previously, we do admit all the patients who have been detected. We have identified hospitals and the central treatment center. We have identified the COVID treatment center that transform Expo, then some Expo center into a treatment center for COVID. It's called MedSynapse in Sabang, which can house nearly more than 5,000 to 6,000 patients of COVID. But now with the increasing numbers of the patients, that touch currently more than 5,000 nearly a day. Currently now in Malaysia itself, yesterday was 8,000, right? 8,000 yesterday. Then so the order or the instruction is for all the detected, screen and detected confirmed positive patient for category 1 and 2 with mild to moderate symptoms is actually for home quarantine. But in this case, they are being monitored and need to have the they have given the home surveillance orders, to ensure they don't go out and quarantine themselves until a certain period or 10 or 14 days and being released. Once they have to do the second swab test to ensure they are free from the disease. in the screening also is actually being carried out in terms of of course, once there's index cases among the close contacts, all this will be identified as soon as possible. Then they'll be screened, isolate, and then there should be home quarantine or admit according to their the need for the admissions, especially the category 3 and 4 and above, which need hospital admissions and treatment or care until they are free from the disease. Other than that, I think our government's currently looking into the increased number of the disease. That it has introduced the restrictions orders. The restriction orders, the movement control orders, and recently it has been announced on the 1st of January that nations undergone lockdown, total lockdown, to reduce restrictions cross-border or spread of the infections of the disease, of the COVID-19 disease. This is to ensure that that the currently the numbers is being bring down into a level that is actually our healthcare system is able to cater, or at least it's not overwhelming our healthcare system, ensuring the numbers of the beds and also the ICU care is actually able to look into these patients, those who are having complications in the category 4 and 5 can be catered and at least reduce the mortality. And then other than that, the screening, the target screening for the high risk population or population at risk. We do go for the elderly homes, right? And then of course the healthcare worker, we do have a surveillance for the healthcare worker who are always at risk in contacting the disease whenever they are at the field or there are health facilities. And also the workers, the industrial workers, they are on and off with the private sectors or the health facilities. They do the screening to ensure that the disease is actually, their premises are free, and once they have been detected the disease, they will isolate them and ensure that they will have a proper treatment for all these workers, right? And then other than that, the ministry is actually produce with all the, of course, the SOPs, the guidelines, and ensuring that all the health providers is actually following the guidelines whenever in managing the COVID disease once detected, either it's in the field or the health facilities or the hospitals, and then the interagency cooperations, to ensure that the being enforced, to ensure that those who have been given house surveillance orders, home quarantine and all that, they actually do follow, and then they don't really expose themselves in the public and causing the spread of the disease. I think. Well, what else I want? I think that's for now to control the disease. I hope it's covered all the screening, the suppressing the disease by containing restriction control orders, and then you track them and ensure isolating them, and then making sure that all the entry points is being guarded. They have enough screening materials, or our thermal scanners is actually placed and working properly to ensure that all these travelers, or the ones who's coming, nations coming back, is actually being traced, tracked, and isolate and being isolated, and then to ensure that the disease is actually being controlled, right? And then for the public health measures, the governments always remind that the publics always comply to the SOPs to ensure that in public they have to be, as far as possible, not to be outside, be in the crowd, and then wear masks when you are in the public. These health advisories has always been they've been delivered to the public to ensure that they follow right? Especially those who are at risk, the elderly, the pregnant mothers, those who are having immunocompromised conditions, they stay at home, and then those need to make sure that the essential needs for them is always available, to make sure that they are not really exposed in the public. The health advice to comply to all the regulations that is being imposed by the government, to ensure that they follow, and the diseases is not it's not being, they are not getting infected, right? And then to ensure that once again, because we have done it before, we have flattened the curve, at a time that we don't have there's a days that we do not have any zero case. So now the Malaysian government urged everybody, especially of course with all the measures, the control measures, that is being implemented currently. If the public does not comply to it, they'll just get themselves exposed. This we won't. I don't think we can win, and then I don't think we can make the disease at. I think. Other than that, I think the mitigation, we are currently in the mitigation phase, and that the Ministry of Health, the government, under the National Security Council, they are heading this pandemic, with us at the Ministry of Health being the most important component of the council. Making sure that all the measures that is being taken, all the measures that is being planned is actually being executed at the ground level, to ensure that the diseases actually can be reduced in numbers and controlled, and the public actually can comply to all the measures is actually being implemented. And another thing is, I think the Ministry of Health has made tremendous efforts in making sure that the health capacities and capabilities, in terms of the resources, in terms of the equipments and the bed availabilities, the ICUs, and also the laboratories capabilities and capacities, has been tremendously being improvised to ensure that we can cope, the nations can cope with the increasing number of the COVID-19 diseases. We also had the other counterparts, the agencies, the private sectors being in, the universities, the Ministry of Education also to be in, the Ministry of the Defense, the hospitals also playing important role in making sure, not only the enforcement but also the screening part of it. And now they are also embarked in the vaccination program, which is hope that will be the not to say the ultimate, but it's the best preventive actions currently that we would like to achieve by end of December this year. I think Ministry of Health Malaysia has had gone into a tremendous efforts in ensuring or making these vaccines awareness is actually being sensitized to all the nation citizens. Of course, it's not the acceptance. Of course, there will be some who is actually, even though with a lot of information, which is the where it's coming from can be like, it is the something which is cannot be questioned, or if it is questioned, the justification for it is actually very clear. Still, there are people, there are some of them who is actually not into it. Right? But the efforts are all, the Ministry of Health has gone into quite tremendous efforts in ensuring that the public is actually getting enough informations, and then which is according to the what has been from the WHO and from all the all the what do you call the test, all has been tested in terms of the quality of the security and the safety of the vaccines. In Malaysia, we have a health advisory or virtual advisory, health advisory, which is in our website, the Ministry of Health portal website itself. There's a lot of the infographic informations, that explain about this, the vaccines, then why, the objectives, the benefits of it, and then the advantages of why they're supposed to get it, so why who's supposed to be protected and all. It's not only that, the websites, we also have our media social TV channels, we have our forums, we have some interview session just like this, and then forums that involves all the specialists or the religious authority, the NGOs, the private sectors, who have all the inputs or the correct, all the accurate input or knowledge about the vaccines to be shared with others. This has been published. It has been shown to the public through the various TV channels, various platforms, and then our websites, our media socials, also in various various venue, right? So it's actually, they can get the informations right there without, and then they can also ask. There is hotlines on this. The Ministry of Health had the CPRC, the Crisis Preparedness Center hotline, where you can just call. Even at the local level, at us at the district level, we go as far as possible. We outreach to the local communities, and then we do have some open booth, do talks, to these especially those who are not able to get the communication, through the line or through online informations, so especially the Aborigines, the Orang Asli, which is, of course, there's no internet line on that. We work together with their departments, the Aborigines departments, and then we arrange for the talks, briefings, and then have a dialogue sessions with them, about this benefits and why they're supposed to be get vaccinated to be protected, and then what is, if they are not, what is the consequences, that they can happen to them if they are not being exposed to the disease. Right. So actually, there's a lot of venues to create awareness. Right. The best thing is we have what we call as can book doc. That means that you just can call the website. In the website there is a Q&A sessions. You can just call, open the website, call on through the lines only. They can have all the informations or any queries about the vaccines. Actually in Malaysia, we do have what you call, the Ministry of Health is actually have the applications, MySejahtera applications. It's actually a mobile apps that can be accessed through your smartphones, and also to the through your, of course, the smartphones and the the iPhones, right? Right. So even without the smartphones also, if they can text messages, there'll be, this mobile application is actually really helps in helping us to trace and track down those who is actually either those with the risk status, of course. In the MySejahtera applications, their profile, their risk status is actually being registered, and then they can be tracked. Of course, we do have that application that the entering the premises, they can be registered, and then if there is any clusters or any index cases that is being detected to have the disease, had visited to that premise, then it can be tracked. Then they can be warned to say that, you have been visited to that place. Then if you are having any symptoms, please go to the nearest health facility and get assessed or screened or otherwise. And then at the same time also, they can get the MySejahtera, then request for the data to look into who is actually had been. The MySejahtera also can notify the risk status of the patient. If the patients who have been risk status, the risk is as either contacts, or actually they have been exposed, or they are actually a positive patient, the premises or the shops, or then they can look into the MySejahtera, and with that kind of risk status, they are not allowed to go inside the premises also. And then at the same time, it's also actually is a tool to ensure that they comply to the regulations. I mean, that has been imposed on them. Like say they are close contact, they're supposed to be under, or a positive patient supposed to under house surveillance orders. They are not supposed to come out. Then, but looking at that, then they are found to be outside. There can be legal actions can be taken for them. So it's very help. It's a very help. I mean, it's a good mobile tracking system. All right. It's just that us has to, download and making sure that the risk status is updated and tracking. And then of course in terms of the confidentiality is actually being it's the confidentiality is being ensured. So the public actually do not they are not supposed to be querying, and they are not supposed to be worried about all the details, all their profiles is being exposed or off to the others, the public. It's only meant for the health Malaysians of government to assist us in controlling and making sure that these people is actually being comply to all the regulations that is being imposed to them. Right? Okay. Yeah, as an individuals, we do know that the infections can be spread through the respiratory tracts. The droplets, or the infected droplets, or the airborne, the airborne particles which is being coughed out or sneezed out by the infected persons, right? So it's actually, of course, if you do not have to go out, just stay at home. But if you need to go out, please make sure that you're being protected. Always wear masks, practice good hand hygienes. Use soap, water to wash your hands at least 20 seconds, or use a hand sanitizers. Whenever you need to, you cannot restrain yourself from coughing or sneezing, please make sure you cover your mouth, using tissues, and then wash your hands again. And always do it frequently, but ensure that without do not or try not to touch your ear, nose, and your eyes and nose and mouth, without unwashed hand or contaminated hands. I think basically that is and of course in the workplace, or where the common sharing areas, that means you may need to sanitize or clean the surface areas that is commonly touched, to ensure that the disease spread is minimized or reduced, to ensure that the disease is not being spread. I think that's the basic hygiene practice that an individual should, or as individuals or as a community, to be responsible for in ensuring that the disease is being prevented from being spread. Yeah, sure. I think it is the currently and that's the looking forward to it, the best option currently to ensure that you can curb the disease. But this through the vaccinations of the community, currently Malaysia is actually going through this the national vaccination program under the Ministry of Health, making sure that there's 70 or 80% of the community or the Malaysian population is actually being vaccinated by end of this year. Then we hope that even though the journey is still very long, the vaccines are coming, then we hope that we are not being, the populations as accepting to it. Initially, we do have some difficulties because they do not really know the vaccines is the side effects, and then with the rumors with the virus, not the about the bad things about these vaccines, the people is actually not really into it. But now, after we have gone through the phase 1, the frontliners, and now the phase 2, that is actually for the high risk populations, the elderly, those with their disabilities and those chronic disease, and they see that the population sees there's not much of a complications. But if there is any complications also, it can be managed by the health. The Ministry of Health. So with that, the acceptance is increasing. We do see an increasing registrations activities, among the populations. So we do hope that this herd immunity, by vaccinating or at least 70 to 80% of our communities, of our population, the herd immunity will be realized, and then the vulnerables will be protected from the severe forms of the disease, and of course the death rates will be reduced, right? So we also hope that the disease is actually, the spreading of the disease can be minimized, and people can go back to the normal, to the previous normal life, without being need to, at one time we are not wearing masks anymore, and then we do not have to restrict our movements, and then we can have our economics and our social life back, the religious part of it, the business, the communities, relationships, and all that, whatever the socials that have previously, then we can have it again. Hope with this herd immunity is currently we are trying to do our best, right, to ensure that the targeted numbers of the population is being immunized, right. At this point of time, I think of course still the herd immunity is one of the perspective that we have to look into, right? Of course, with the variants of concerns that is being has been announced by the WHO, that certain countries is actually, the mutations of the virus and all that. I'm sure that the WHO, the specific laboratories and all that, they are looking into this, studying about these variants, this virus, the variants of concerns, and coming up with the new vaccines, or and to ensure that it's actually eventually that these variants of vaccines, these variants of the concerns is actually being tackled by the development of the new vaccine, if there is if not, if let's say that the current vaccines actually can be used to at least give some protections. I think the herd immunity is still valid at this point of time. Meanwhile, I think we at Malaysia making sure that these variants of concern is actually, we're not sure how far it is still in Malaysia, but the laboratory, the IMR, the Institute of Medical Research, with the National Public Health laboratories, and our National Health laboratories also is looking into this variant. The pathologists, the scientists is looking into the variants, and then they're trying to get to into it, making sure that in one time, with the knowledge or with the sharing of the development from the other countries, hoping that these variants also should be covered, either by these current vaccines or the new vaccines that is going to be developed. But at this point of time, for the current period, the herd immunity is actually should be the one of the best. I mean, one of the venues that we are supposed to be ensuring, that our, at least the population currently is being protected towards these variants. I think at this point of time, the herd immunity is still be one of the best perspective, while some the new developments, or the new the laboratory is going to the experiments or whatever, is looking into ensuring that hoping that some at one point the new vaccines is be there to be protected, and of course if we can, the public can comply to the SOPs, making sure even though with the new variants and all, we still can be protected against the virus, the disease, right? I think that's it.